The practically instantaneous flow of data defines the information era. New technologies that are both adaptable and effective are already standard practice for many large corporations. Small firms have recently been able to get ahead of the curve and apply their solutions. With regards to healthcare information, the ability of companies to seamlessly exchange information can make or break a patient's life. Bill Clinton signed into law in August of 1996 the Health Insurance Portability and Accountability Act to encourage the safe sharing of patients' information, HIPAA. In this video, we are going to discuss about HIPAA laws for the secure and private transfer of an individual's medical information. Before we continue our video, make sure to subscribe to our channel and hit the bell icon for more interesting videos. So, let's get started. 1. HIPAA Privacy Rules. The Health Insurance Portability and Accountability Act, HIPAA, protects healthcare information about individuals and groups. Many health insurance programs, including Medicare and Medicaid, health maintenance organizations, HMO, and private health insurers. Under HIPAA's Privacy Rule, the information is protected is individuals' comprehensive medical history, including both physical and mental disorders, and individuals' access to therapy or services and information about a patient's insurance coverage for this health care. 2. HIPAA Security Rule. The more easily data can be transferred, the better for the company. Sadly, malicious forces are searching for ways to get their hands on this information for their objectives. In healthcare, data is more personal than in any other sector. When it comes to protecting electronic health information, HIPAA mandates several safeguards that must be implemented by covering parties to ensure that the data is safe and secure at all times. These safeguards include administrative, physical, and technological measures. The Centers for Medicare and Medicaid Services administers the security rule. 3. Electronic transaction and code set standards. For patients, uniformity of electronic transactions is critical to the efficiency of care. Healthcare providers must follow HIPAA standardized guidelines to ensure that the healthcare providers can easily understand the financial and medical information they are transmitting. HIPAA establishes a standard for electronic fund transfer, electronic remittance advice, and claim attachments under the Electronic Communications Privacy Act. The Centers for Medicare and Medicaid Services, CMS, is responsible for implementing this part of HIPAA. 4. National Identifier Requirements. Healthcare providers are required by HIPAA regulation to utilize certain health plan identifiers, HPID. These are unique numbers issued to every patient's medical records. When it comes to allergy testing, the number code used by each provider is the same. Providers can avoid the problems of understanding the type of care to be supplied and the act of charging for the services obtained because of this level of uniformity. The IDs are controlled by the Centers for Medicare and Medicaid Services, same as the transaction code standardization. 5. Enforcement and penalties. A governing body is required for every legislation. HIPAA is no exception. HIPAA's enforcement rule was put in place to ensure that the law regulations are adequately enforced. The Office of Civil Rights enforces HIPAA Security Rule and the rules governing information standards to address the privacy issue. Since the Health Insurance Portability and Accountability Act requirements, there has been significant growth in electronic data interchange in healthcare. As part of the 2010 Affordable Care legislation, provisions were put in place that enlarged these computerized exchanges and included additional standards to reflect the fundamentals of the first act. In addition, health plans must confirm their compliance with the Affordable Care Act of 2010, passed in 2010. Failure to certify or comply with the new standards and operational regulations will result in severe penalties under the Act. In addition to penalties, there is a maximum penalty of $25,000 per year for infractions of the same rules, $100 per violation. Penalties for the wrongful disclosure of individuals are one might face a line of up to $100,000 if he or she makes an unlawful disclosure or pretenses, or a fine of $250,000 up to 10 years in jail, or both, is imposed for the unauthorized disclosure of information to resell it, and additionally, HIPAA-compliant organizations will undoubtedly face a loss of public trust and income due to their failure to adhere to the laws. Hope you guys enjoyed the video. Contact us to learn more about HIPAA and our role in protecting your data. We can help you understand HIPAA regulations and provide secure data transfers for your medical practice. Goodbye.